Good evening, Dr. Vikram.
Good evening.
Dr. Vikram, today we want your views about ulcerative colitis problem,
Yeah.
which is very common these days due to lifestyle and irregular dietary things. So please explain about ulcerative colitis.
This is a very troublesome problem for so many patients. It is very painful, sometimes very diarrhea, bloody stools, mucus in the stools, so many symptoms which are really problematic for the patient. So it has the incidence has increased a lot of this problem. Ulcerative colitis actually is ulceration in the colon, mainly in the colon area, not in the intestines. As you know, intestines. I want to show you the intestines. This is the food pipe, and then stomach, and then there is small intestine, right?
Yeah.
And then there is this just a representation. This is a colon. This is, if you understand, like this is a food pipe, and there is stomach, and then there are intestines, and there is ascending colon, transverse colon, and descending colon. Usually the colon or the large intestine, it is swollen and inflamed. There are ulceration in the inner lining of the large intestines and the lower rectum and the inside the anal canal. So that is very painful also. Sometimes the patient complains of pain in the left iliac region and in this region of the descending colon. And this leads to a lot of pain and discomfort and so many serious complications also sometimes.
So Dr. Vikram, my question is, what are the causes? Why someone suffers with this very severe problem?
There are so many causes. Hereditary is one of the reasons. Some relatives of the persons.
Someone in the family,
something can suffer from this. Some hereditary causes are there, but lifestyle also plays a major role in this disease. Lifestyle, if the diet has an important role to play in it. Nowadays you see people are working and even not sleeping at night, working late at night, and eating, once you have eaten something, they eat just after, even if it is not digested. One thing they eat, then after a few minutes or 1 hour or half an hour they eat something else, or they eat frozen food, they eat cooked food, uncooked, the food which is really not good for health. The stored and the frozen and the
fried
burgers and pizzas and everything.
Junk food basically.
Junk food, yeah. So junk food is really heavy on the intestines. It goes into the intestine and it starts to ferment. So yesterday I was reading somewhere that 1 can of Coca-Cola, it contains 24 sachets of sugar, equivalent to 24 sachets. So Coca-Cola also contains, all the cola drinks and everything, they contain so many other chemicals also. So people are nowadays consuming this like water. It should be avoided. Healthy food should be eaten.
So Dr. Vikram, once if someone suffers this problem, what are the symptoms he can guess that he is suffering with ulcerative colitis?
As I told you, there is stool and diarrhea. There is continuous. There sometimes people come to me with, they are complaining about 20 times. They go to 20 times. They go to 30 times. So the severe diarrhea is there. This is number 1 symptom. The pain in this region is there, abdominal pain and discomfort. Sometimes there is pus in the stool, mucus in the stool, and there is fatigue and tiredness and nausea feeling also there, loss of appetite is also there. So there are such symptoms. Anemia is there. Anemia leads to fatigue and sometimes dizziness. So these are the main symptoms, and the patient comes to our clinic and with the reports of this endoscopy is usually done. With the endoscope we use colonoscopy, sigmoidoscopy is done, and biopsy is also sometimes done. And sigmoidoscopy or colonoscopy reveals the inner picture of the if the intestines. The scope is inserted through the anus, and then the camera takes the pictures, and the picture of the inner lining of the colon is taken. And usually it is ulcerous, full of ulcers. That is why it is called ulcerative colitis. Colitis means inflammation of the colon, and ulcerative means there are ulcers also in the inner lining of the colon. So we need, definitely we need, it is a strong, ongoing, continuous inflammatory process inside the intestines, inside the colon. And that happens because of the continuous fermentation. Just leave some junk in an area, you will see after some days of 15-20 days, 1 month, it will start to ferment. Constipation aggravates the symptoms, leads to this disease. Not aggravates, because constipation is not the actual symptom. Once in the initial stages the person is constipated, and then slowly the food is fermenting and causing these ulceration and inflammation in the colons. So that leads to ulcerative colitis also. So there are many immunosuppressant medicines given. Mesacol is there, and there are Imuran, very strong immunity suppressing medicines. Anti-inflammatory medicines are given, which are very strong. Sometimes steroids are also given, which are also very strong. But all those medicines, they have severe side effects also. But naturally we can get very good results. Even today I was having, I saw some patients, and one of them, he was suffering from severe ulcerative colitis, going to stool for 20 times a day.
I remember Mr. Preet, in the morning he came.
So there are so many patients who come and they get really benefit. Now after 3 months of treatment, he is perfectly alright. This is what he said. Similarly, I gave him just basics. In Ayurveda, we call this ulcerative colitis as sangrahani. This sangrahani is of many types, Vata, Pitta, Kapha, and Sannipati. So we heal the sangrahani, we treat the ulcerative colitis with the Ayurvedic remedies like Vatsakadi Churna. Vatsak is the Latinum of this plant. It can be read over internet. It is called Halorina antidecentrica. So this is a big tree called Kutaja in Sanskrit, Kutaj. So Kutaj is what I use. Vatsak is also the other name of this plant. So Vatsakadi Churna is wonderful for this problem. Pitta balance is a formulation which contains natural calciums like corals and pearls, which are very good to heal the wounds. And I use Arjuna also. I recommend Arjuna. Arjuna is very cooling in nature. It helps to stop the bleeding. It is Kashaya rasa in taste. Kashaya means astringent. So it is also a very strong wound healer. So it helps to heal the ulcers. It helps to stop the bleeding. It helps to clear the infection. And along with Vatsakadi Churna, I use it. So this combination is what I am using. Combination of Kutaja and terminally Arjuna and some corals, calciums and such things, which are very rich in natural calcium. And the remission state is achieved. Once remission means temporary halting of symptoms. Once the remission state is achieved, then continuous use of the same medicine for about 3 to 6 months, that leads to the cure of the problem. So ulcerative colitis is very much possible to cure using natural medicines.
That's great.
Yeah, and one more thing I want to tell. People that consume a lot of proteins. So I would suggest do not take any protein during if you are suffering from ulcerative colitis. Like people, they consume non-veg food, they consume pulses and cereals. Not too many, because they are dry in nature and they don't heal the wounds. So non-veg food is not recommended at all. This alcohol is not recommended. So these soft drinks are not recommended. The fried food is not recommended. This frozen frozen food is not recommended. Stored food is not recommended. Fresh vegetables are very good.
The gourd family vegetables like bitter gourd, long gourd, the round gourd, we call pumpkin also. Pumpkin is very good. Pumpkin is wonderful for ulcerative colitis patient. It can stop the bleeding. It can heal the wounds inside the intestine. It can do miracles for ulcerative colitis patients.
Okay.
Simple grass is wonderful because grass has a property as a hemostat. So simple grass, the juice of the grass, you can crush the grass and consume the juice, spoonful morning, evening. Marigold flower petals, they are very good to stop the bleeding.
Okay.
So all the cooling herbs, very good for this mulatti, what you call that, Glycyrrhiza glabra or licorice in English.
Licorice, yeah.
Licorice is very popular. It is also having very good healing properties. So licorice can be chewed, the root of licorice in small quantity. Asparagus is very good. Asparagus also heals. The shatavari.
Okay.
And the pomegranate, I forgot to tell you about pomegranate. Vatsakadi churna contains the fruit rind of the cover of the pomegranate.
Okay.
So pomegranate is also
So
very
fruit
useful.
juice can be used also?
Citrus fruits I don't recommend.
No, pomegranate juice.
Pomegranate juice is good, very good.
Okay.
Every day one can consume pomegranate juice. And citrus fruits, juices like lemons and oranges, I don't recommend in case of ulcerative colitis. So they cause imbalance of the pitta, because it is a pitta disease, mainly raktatisar.
Okay.
In Ayurveda we call raktatisar, so the bleeding dysentery or bleeding diarrhea. So in that case, pitta aggravating foods are not good. So pitta should be balanced. So cooling foods, cooling things like I told you, pearls and corals, they are very cooling in nature.
Okay.
So pitta balance is what I use. And
Dr. Vikram?
melons are also very good.
Okay.
Melons, simple
Okay.
melons
Okay.
are good. Citrus fruits and sour fruits, they are not really recommended. Milk is also not recommended. I don't recommend milk to my ulcerative colitis patients.
Milk or milk products.
Yeah, milk and dairy products, because they put a lot of burden on the intestines.
Okay.
So I don't recommend them.
So Dr. Vikram,
Lassi, I'm sorry
buttermilk?
to interrupt you. Lassi is called takra in Ayurveda.
Okay.
It's
buttermilk in...
buttermilk, yeah.
Okay.
Buttermilk in English.
Uh-huh.
It is equivalent of probiotics.
Okay.
In modern terms, you can
Okay.
say. So
So
takra
natural
or
probiotics.
natural probiotics they are very good for ulcerative colitis.
Okay. So Dr. Vikram, apart from this, do you suggest any lifestyle upgradation like stress is, I feel...
Yes, stress is very major cause of all ulcerative colitis patients. I see they are very living in a stressful situation, and stress obviously aggravates all the diseases. So stress should be addressed
Okay.
at all
Proper
costs.
sleep and stress.
Proper sleep and proper diet and proper nutrition and proper consolation and counseling is very important in ulcerative colitis patient. They go into depression, and some of my patients, they come to me, they say we are not going to the work, they are going to leave the work also. So it's very important to take care of stress.
That's great.
Yeah.
So Dr. Vikram, thank you very much. I think this information will be very useful for patients suffering with ulcerative colitis. Thank you.
Very much. Thank you.